Hi everyone, good afternoon, good evening to people from the various zones. So my name is Shankar Subramaniam Iyer. So I'll be speaking on environmental health and safety and try and cover the fundamentals or what's required to be known in this particular subject. So we just take a look at what are the various backdrop terminologies which need to be known in this. So what is health and safety? We'll try and cover, or accident. What is an incident, or what could be an hazard? What is the regulation? What is the policy? And what are the risk assessments and how they are done to that extent? So that's all we'll be trying to cover in this webinar. So basic definitions is what we'll try and cover. Accident is any unplanned event that could result in an injury or ill health of a person, or damage to property, or damage to life of a person, material or environment, or could be a loss to of a business opportunity. So like a person is, let's say, climbing on top of a roof and trying to fix something, slips and falls. So there is a serious injury, maybe break his back and incapacitated for life. So the value of life itself is at question. And then obviously other people who are affected at the workplace and family, near and dear ones who are going to be affected by this accident. So we are aware of these kind of situations in our workplace and in normal life, keeps happening every other day. So if we are aware of these things, maybe it can be reduced. How to take care in such situations, how to bolster ourselves so that such accidents can be avoided. Because the more you are secured, so the more is the morale of the workers and the employees. So incident is an unplanned, undesired event that can adversely affect completion of a task. Okay, so it is something has gone wrong, but it's not led to an accident, but could be in the future. So that's an incident, but that needs to be reported and immediately taken care of. Like for example, the same person on top of the roof has gone there, and suddenly the belt gives way. One of the buckles give way, and then that's an incident. And then the worker manages to tighten it, and is okay. But that's an incident. So how it happened, why it happened, and what should be done that it's not repeated, because that incident can be accident, and that can be a dangerous hazard. So near miss is an incident that could have resulted in an accident. Okay, so knowledge of near accident misses is very important also. So dangerous occurrence is a near miss which could have led to a serious injury or loss of life. For example, let's say aircraft is just about to start, and someone notices that there is a small tiny bolt which has got stuck in the fan console. So immediately because of the noise and the misbehavior of the fan and the engine, the pilot immediately stops and calls for immediate checkup. So that's a near miss, which could be it's also an incident. It could have led to a major accident. So then we have terms like hazard. Hazard is a potential of a substance, activity, or process to cause harm. So risk is the likelihood of a substance, activity, or process to cause harm. So hazard is anything which can cause harm in a workplace, at your sites, could be at home, could be at any place. So like, for example, a wet floor can be a hazard because a signboard is not put up. So someone may come and slip and can lead to a major accident, because depending on the fall and how badly the person is hurt. So that's a hazard. Safety regulations are the strongest form of official advice that employees must follow, and they are legally enforceable. So we have various safety regulations uh, at workplace, and it is kept everywhere. It is the awareness is on boards or notices and so on. So health and safety policy sets out the general approach to health and safety. It explains how, as an employer, we should manage the health and safety in a business. Okay, so that's the policy what the organization has. So everyone, by the best in turn, have that the premises is safe, the employer is safe, or people visiting that office is kept safe. So that's the general health and safety policy every company has. Only the realization and the adhering to those policies is very important. So risk assessment is a term used to describe the overall process or method where one can identify the hazards and risk factors that has the potential to cause harm. And it's a repetitive process done again and again on a continuous basis. So we analyze and evaluate the risk associated with that hazard. And so it leads to a risk analysis and a risk evaluation. So these are some of the terminologies which we will be using. So it is very imperative that we try and clear these terms which you're going to use, or which we'll be hearing over this webinar and also probably in the professional world. So accidents cost money, obviously. So they're costly directly or indirectly. So you see, if a person is falling like this, what happens? There is suffering, personal suffering, stress, loss of earning, big loss to the family, loss to the, in terms of compensation, legality of the organization. So the performance goes down and the morale of the staff goes down. So that's why accidents have many dimensions which one should be aware of, and that's why it's very much avoidable and should be avoided. So what are the health and safety hazards generally we face? So it can be due to substances, due to fire, due to irritants, or could be because of chemical exposure, can be a gas cylinder at a workplace, in a restaurant, corrosion, which sets in various equipments which not used and not cleared properly. Then could be a chemical explosion or exploding bomb, or it could be a fire, environment. Okay, and these are some of the signs which show hazard, and some of the terms which generally are shown at the workplace and in various brochures and websites and health and safety books. Okay, so which are the general regulations applicable in the workplace? We have various of them. It keeps adding up because the perception of health and safety hazards, risks is keeping on increasing. So earlier it was not so complex. We just were looking at the fire and a chemical exposure and something. So recently you will see it has led to bombs, terrorist activities, or probably even chemical warfare, biological warfare, and what do you call as exposure to virus. So these are some of the hazards which have recently popped up, and how humanity is going to take care of this is also to be made into a policy and a regulation very soon. So these are old regulations, just to understand what are regulations. So health and safety procedure regulations of 1974. So basically, it's all regulated by the HSC, that is a Health and Safety Executive, which is the parent organization situated in UK, which governs most of this health and safety in workplace regulations. So, and most of the other countries and most organizations adopt this. So, Management of Health and Safety at Work Regulations 1999, the Workplace Health and Safety and Welfare Regulations 1992, the Health and Safety Display Screen Equipment Regulations 1992. So there was when the PC exposure was on. So exposing oneself to the screen for a period of time and the way you sit, the ergonomics and the exposure of the screen, the strain to the eyes, the stress on the health, all that is covered in that. So particular protection equipment at Work Regulations 1992. So personal protection could be in terms of wearing helmet at the sites, work sites, or mufflers in the airports sites where you're working, or ground staff at the airport. Or it could be even a welding mask you want for welding. So things like that, which, and also in some places where you're dealing with chemicals, you can wear a mask, you can wear maybe a full suit, gloves, these kind of exposure, gumboots, where you're working in the furnace areas. So manual handling operations regulations. So the way how you handle heavy weights. So you have trolleys, you have folks to lift the heavy equipment, and in godowns or in workshops and warehouses, things like that, which are covered in that manual handling operations regulations. Provision and use of work equipment regulations. So how the various equipments can be used at the workplace, various equipments that could be in terms of for movement, a forklift, or even a car across in the warehouse for moving equipments, or for even moving passengers, or even looking at a metro at the airport like Dubai. So things like that comes into play in this kind of regulations. Reporting of injuries, diseases, and dangerous occurrences regulations 1995. So how the occurrences are reported, it's got a template, definite template, and how they can be escalated to various places in terms of policy and to various levels, and then the incidents taken note of and how they are met with. So all that is reported in that 1995 reporting of injuries and diseases and dangerous occurrences regulations. Working time regulations, like continuous exposure to workplace. So generally it's a 8 to 10 hour shift, and more than that exposure should be given with a time break in between. So like how we have pilots cannot fly continuously for more than 5 hours and then they get a break. So it reduces the stress and it reduces the chances of accidents and what do you call as mishaps. So because if you are in continuous stress, human ability to work comes down drastically. So this is normally avoided by these kind of work time regulations act. So these are various regulations which is normally used and helps the organizations and various agencies to report the incidents, accidents, hazards, risk assessment, and to reduce the accidents which can happen at the workplace. So what are the general health and safety hazards? Prevention is better than cure, obviously. So we would like to first identify before any accident happens and to remove that root cause of an hazard so that the accidents are avoided totally. Prevention of safety hazard can control costs. So these are the consequences of negligence which could happen, which we should take care of. So like in this picture, you see there are cables running all over the place. So chance of tripping, and you have the various people, things sitting on the ground, or some are sitting on the table, and the books and other things are piled up. And there is a guy who is climbing a ladder which is not stable. So all this is a show of sure shot accidents. So any of these or all of that can be dangerous. So which you should take care of. So just to show exposure, what can happen. So or a old lady walking on pebbles and in an unstable way, unstable posture can lead to a fall and hit. So these kind of things have to be taken care of. So the value of safety culture, it comes to, it's coming from the leadership, the ownership, the communication, rules and procedures, how you recognize and self-verification. So that's a safety culture. The value of safety culture for any organization is very high, because what happens is, one is the person or employees or visitors to any place are always need to have a secure environment, because if not secure, the morale is down for one. Second, you are always on a lookout for some danger, and the focus on the work what you want to do will not happen. So the efficiencies are coming down, and God forbid if there is an accident. So on top of that, you have the compensation, you have legalities, then you have loss of uh, time, compensations to be given, and also you have to find a replacement for the employee who has been injured, and a lot of other complications like personal losses for the family, and the breadwinner is not well, hospitalized, so the company has to pay for the hospital charges, and then generally the morale of the crew and the employees come down. So that's why it's very important that the safety culture should be on the highest point, and then it should be one of the strong points of the organization. So the employees are known and the organization is known for the safety culture. So if you look at a lot of companies, maybe I can take examples of Dubai. So you see Emirates Airlines, for example, or you're looking at Diva, or you're looking at ONGC. Despite the sector they are and very high prone for accidents, still the number of accidents is very less. So that's because of the safety culture. So every person, every individual takes his onus to be part of the culture and to avoid and identify the dangers and the hazards. So if you look at the definition, the safety culture of organization is a product of individual and group values, attitudes, perceptions, competencies, and patterns of behavior that determine the commitment to and the style and proficiency of organizations' health and safety management. So it involves each and every person, management, as well as the employees, the staff, even the people who are temporarily involved in the organization. All of them should have this sense of safety, and that's the organization culture, and it's definitely highly valued. The next thing is organizations with a positive safety culture are characterized by communications. So there's a natural trust because of the communications. There's a flow of communication from top to down and down to bottom, and then from the bottom to the top again as a feedback. So the mutual trust is kept, and the shared perceptions of importance of safety and by confidence in the efficacy of preventive measures. So that leads to a positive health culture. So workplace EHS activities are like proper communication on notices, emails, notice boards, newsletters, workshops should be always on continuous basis, and people need to keep talking about it every time. It's not only ref to that, even every time you come into the workplace, you can take a look at on, identify any crucial hazards or which could accidents which could happen, and then try and talk about it and spread the awareness. Then system for assuring employee compliances with safe workplace practices. They have scheduled inspections, evaluation system on a regular basis, inbuilt into your program or your daily activities or weekly activities or a monthly activity. So accident incident investigation is done. Then procedures for correcting unsafe, unhealthy conditions, safety and healthy training and instructions, and recording all these incidents and documentation of that. Some of the workplace health and safety environment, health and safety activities. Generally, a workplace hazard could be in terms of electrical shocks, falling objects, chemical substances, slippery floors, unsecured items, furnaces, objects lying on the floor. So the emptying number of uh, points where accident can happen. So what happens is how it can lead to a personal or a worker falling from height, machine injury, noise hazards, which happen quite in some places at construction sites or near airports and ports, or when you're working in areas of generator. So high machine frequencies and noise can affect your ears. So light hazards like welding, which can be harmful to the eyes unless they use the proper equipment. Then even continuous exposure to TV screens and PC screens is a hazard. Poisonous gases, leakages, ergonomics, the way you sit at workplace, you're sitting continuously in one place can lead to a health hazard. So it's required that you need to take a walk, maybe once an hour. You need to take a walk, stand for some time so that the blood circulation keeps going. So radiations are another issue. When you have extreme temperatures in the workplace where you're working, the workers are exposed to high temperatures when they are out in the sun, working on the construction sites. For example, I see them or working on the roadsides. So working at 40, 45 degrees centigrade, even higher. So leads to dehydrations and again lead to dizziness and fall. So forget even normal walking will be difficult. Working in those conditions is hazardous and what do you call bad for health. Visibility is another thing. No lighting, less lighting, weather phenomena. So very what do you call foggy, misty kind of atmosphere where you can't see. Visibility is less, can lead to accidents. So how to avoid workplace hazards? You should have awareness what can go wrong and what situations what to do. Training of the personnel on these hazards every time. Keeping health and safety aspects in design in your everyday activities. Regular inspection for health and safety aspects. Regular health and safety audits. Promoting and rewarding the safe practices of the workplace. Regular benchmarking practices. These are some of the things you can do to avoid workplace hazards. So EHS is a good career option and goes well with engineering background and with management subjects. So careers objections of the what do you call the options. The academic view is career certifications, degrees, subject specialty. Okay, so that can lead to academics. You can be a lecturer, you can be assistant, you can be a health and safety officer in the academic sections. So I'll be teaching or in the labs, for example. So it could be a EHS manager, could be a company need, sector needs, and the society needs officers, assistants, EHS workers, frontline workers. So especially the healthcare issues which are faced in the last 2 years, 3 years, healthcare management and healthcare sector requires a lot of health and safety managers and workers, nurses, for example. Regulations are from the government, HSC, that is the health and safety executive, and the inspections which are done. So mental assurance is given by audit, quality assurance, you keep checking, continuous improvement can be done on this, and then the customer expectations. So these are some of the aspects which form the gamut of health and safety, environmental health and safety. So career options can be, you can be a consultant, so you can be advisory, you can be an auditor, You can be a safety officer, industrial hygienist, environmental science and safe, protection technician, environmental health and safety manager, officer, air quality specialist, water treatment specialist, OSHA compliance assistant specialist, so occupational health and safety and health assurance compliance assistant specialist. Then you can be a safety inspector and so on. So the list is never ending. Actually, I've just given you some exposure. You can also find out a lot of more on that. We will be definitely covering more so in the future webinars and probably at the workplaces or even at when you come for inquiry for the various courses. So key elements of a EHS management system are: you have to have a policy in place, you need to organize the culture and so on, the environment. Planning and implementing is very important, and you keep measuring the performance, reviewing the performance. Regular audits are required, and the feedback loop is very important. So unless you have the feedback loop coming back, it's not going to help, because as you come back and the feedback, okay, so it will lead to better feedback is always important in terms of auditing, in terms of a circular loop. So what is the things we need to do is identify the hazards. So the two pictures are given, for example. So activity is to avoid such hazards. So we'll take a 2-minute look at the activity just to identify, and maybe you can put on the chat, or you can, if we call this as activity 1, you can write down and we can discuss it after 5 minutes. Identify some of the regulations which come into play. I can just discuss now. So you can put in the chat and we can look at it. So you see the man is who is painting or spray painting the roof is not well bolstered. He's just standing on a regular ladder, and it doesn't have a support, a belt from the ceiling. So chances are, if the ladder is unstable or it turns in one way or other, it will the ladder would wobble, and the chances are he is going to fall down. So that's the hazard. So it needs to be bolstered with a belt. Identify some of the regulations which will come into play. So Work and Safety Regulation Act 1992, very much applicable. So even in the below, you'll see all those pipes lying on the premises in the middle. So anything you see the crane forklift of the operator coming across is not even able to see the pipes lying there. So there are all chances of a definite hazard. And then you see a fellow standing on top of 2 boxes trying to adjust something on the store, which is not stable, so could be lead to a fall. So person who is climbing down from a ladder without any help. So all this can be chances of accidents and hazards. So things to do: identify jobs that involve work at height and plan the work to ensure that appropriate precautions are in place. Have a risk assessment in place on a continuous basis. Have procedures for the selection of correct equipment and ensure that the selected equipment is actually used. Because you may say that this equipment, the awareness is that you have to use this equipment, but the equipment is not available. Then you should go out of the way and check and to find out what this equipment is available or no, or what's the reason. Go to the root cause. If the management is not able to get this, so you should stop at that place and tell them what's the chances of having accident and order for the equipment. Otherwise, it's going to lead to hazard and maybe a loss of life or whatever, which can be avoided. Then should we communicate the health control measures to the workforce on a regular basis, workshops, training, notices, emails, notice boards. Ensure workers are competent to use the equipment that has been correctly installed and assembled. So give them the training, necessary training to look at it and how to operate and how to maintain the equipment. Arrange inspection and maintenance of the equipment as appropriate. So again, you see a construction site, and you can look at the scenario, and we can discuss now what can go wrong. You can talk of, or you can put on the chat box some of these points. So it can be peer to peer. Someone asks a question, someone else can answer it, and then it can be bolstered by the ourselves trying to look at it. So we'll try to get some interaction with the crowd, the attendance, the participation. So the next 10 minutes will be on this. So then what are the ways of doing it properly? So you have the OHS policy, planning, implementation and operation, checking and corrective action, management review. So this should become on a definite continuous basis. Okay, and continuous improvement can always be possible, or the principle of Kaizen can be introduced here. So job skills is what in a EHF you require is the eye for pointed details, able to identify hazards, get to the root cause, find ways to mitigate or eradicate the danger or risk, find solutions, bring awareness and spread awareness on ESH or the environmental health and safety, support the safety culture and the importance, benefits of such culture, build teams to spread and assess risk, continuous updates and training to everyone. So continuous improvement will look at first plan, do, check, act, and keep repeating it. So the most efficient part to reduce accidents and improve safety in the workplace is to continuously improve. Review the issues, incorporate solution, maintain a focus on safety at all levels. The benefits will be in saving time, saving money, no legal complications, increasing the customer satisfaction, employee and stakeholder confidence, morale is improved, and the brand name is also enhanced. So what are the 5 steps of risk assessment? So identify the hazards, decide who may be armed or how, evaluate the risk and take action to prevent them, record your findings, review the risk assessment, and keep doing it on a regular basis, continuous improvement. How risk and hazards keep increasing. So as I said, the perspective is always changing. So in the recent phenomena, last couple of decades, you have the malls. So a bomb in a mall or a bomb scare in a mall leads to a stampede is one of the major hazards, or a fire in a mall. Okay, so even in events, it's a similar thing, or you have the war zones leading to bombing, missile fires, gunshots. Sudden wars can happen, like how it's happened in Yemen, how it happened in Ukraine. So the common man on the street is at stake. So natural calamities can lead to health and safety and risk. So how to cover that, and environmental awareness is a must, because increase of plastics. So you have the global temperatures rising, so the sea levels are rising, so melting of the icebergs, and general temperature increase almost 4% across the globe. So that's why higher temperatures so leads to more what you call chances of losing dissipation of water or sweat, and leads to dehydration. So the EHS program should always be agile and self-adjusting and depending on the culture. So agile work safety program can reduce risk, reduce incidents, lower the cost related to injuries, and build a better health and safety culture. So agile is the ability to make strategic shifts in the systems, processes, and technology. For a company to be considered agile, It must be able to change from one stable system to another in a timely manner. So agility is something which is also a culture which happens. So you look at the Japanese culture. So they had this earthquake, then they had the tsunami. Then within companies like Toyota, for example, were up again, and all the setup again in 6 to 7 months and reached the same production levels. So that shows how agile they were and how resilient the organization is towards a crisis. So EHS crisis can be anything. It could be an earthquake, it could be a tsunami, or it could be a COVID. So how fast the organization responds and is resilient to get back to operations in a safe manner is the resilience of the organization, and it also shows well on the safety culture and also how they respond in terms of crisis. So you have disaster committees, you have disaster management and risk reduced. Benchmarking and standardization is a must, which is generally followed. If you're looking at the HSC policies on EHS, it is very clear. Standardizing the processes reduces confusion and non-compliance, so you don't miss any detail. But having a rigid safety system can produce undesired results, effects, such as complacency and hidden risk. So it is better to have an agile EHS culture. Important organizations you will hear in EHS is IBOSH, HSC, OSH, ISO. Then objectives of a total safety culture: safety as a way of life, creating ownership, owning to the safety. Then infrastructure needs met and provided for, safety as a personal value, safety leaders in place, safety pyramid, hazard recognition and control, near misses report meticulously without any delay. Then layered safety interaction, internal responsibility system. So who is responsible and what more you can do to own up responsibility. And this is a habit as a culture, communication done very meticulously in details, and positive safety culture all leads to a total safety culture. So objectives is safety as a way of life, creating so total safety culture can lead to positive reinforcement. Categories of reinforcement can be economic, monetary value, social, moral, and also the response. The peer pressure. So what it means is basically when you're looking at positive reinforcement, the economic is monetary value. Okay, so it will lead to less legal assets and compensation payment, and as a reward for motivation, it leads to more benefits. Okay, so that's the economic front. The social is a positive interaction between the people, leads to morale building, team building, safety assurance, and the safety culture in place. So it bolsters the health and safety culture at the workplace, and people are secured. So morale, the right thing to do, it leads to inner satisfaction for everyone. So also the peer pressure will work out to see who is contributing to this. Safety policy is the goal of organization and its employees to ensure that work and all other activities protect and promote the health and safety of employees, visitors, and customers. So that should be a general safety policy which is followed. Safety principles is we have to make people accountable, responsible for continuous practice of safety and environmental compliances. Nothing is so important that it cannot be done safely. So safety first priority is a must. Overall success of a safety program is a shared responsibility. As I said, everyone needs to contribute participation for everyone, from everyone, will only make it a success. Otherwise, even one person not doing it can lead to a disaster. Supervisors and staff must show leadership and provide good example. So generally, we look at zero target. So goal, something to work towards, take responsibility, don't wait for others to do something, change way of thinking. That's a culture. Zero accidents is a goal. The safety team is generally management, the employees, the EHS team, supervisors, employees, and safety committees rather. So management responsibility is the key because they are the main contributors. They are the people who are looking at the investment in terms of equipment, give them the safety environment for the employees, and the ultimate responsibility for safety is the owners of it, lies with the management. So legal obligation is to provide health and safety workplace, which is a must as per the government rules as well as the health and safety rules. So provide leadership and makes safety a priority, display proper attitudes, and provide resources. That's the job of the management. Supervisory responsibilities is point out in case there is something wrong or something can be improved. Leadership should be taken on. Attitudes can be checked and reinforced. Then provide resources, use the resources, safety in work plans, evaluation, feedback on safety and environment, ensure training is provided and you attend, respond immediately to the safety issues. Employee responsibility is to active participation in the programs, in the workshops, continuous practice of compliances, own responsibilities, be part of the culture, use the safe tools and equipment which are given, wear PPE, always notify supervisor of accidents, near misses, splits, fires, hazards, notify supervisor of any impairments. Example of safety committee, environmental radiation, biological infection, control and animal care committees, departmental and unit committees, facility services safety committee, housekeeping safety committee, advisory input and review, identify problems and solution, and that's not for imminent safety issues. So modern technologies can be used, simulations. So simulations can help to build on the scenario. So see how people will respond, like a fire drill, for example. So EHS crisis can be simulated. So due to plastic, biological attacks, nuclear outbreaks, and see how people respond. The practice in such, whether the equipments are put in place and they are all working, and how the people respond, how they evacuate, and things like that can be practiced on a regular basis, so that when the crisis is there, people are ever ready. So practice in such situations can be done by drills conducted. The CCTVs, drones, the AR, AI, ML can help create such patterns and see how the situation can be faced. So that's the end of the webinar. Any questions or any clarifications are welcome.